Assalamu alaikum, my dear student. Hope you are well and staying at home. Actually, we are passing a very critical time of pandemic attack of COVID-19. We are all are locked down, but you don't waste your time. You should utilize your time properly as your best. You should make a routine and study accordingly. Today, I am here to discuss a new topic. So I am talking about the new topics is drugs used in pregnancy. Actually, a pregnant woman during her pregnancy may suffer from medical diseases. We have to prescribe many drugs, but all drugs are not safe to the fetus or also to the mother. So, drugs are categorized. Pregnancy category of a drug is an assessment of the risks of the fetal injury occurred by the drugs. US Food and Drug Administration has categorized grading system for medication used during pregnancy. The categories are A, B, C, D, and X. Now, what is category A drugs? Drugs that have been tested for safety during pregnancy and have been found to be safe. In practical purpose, there are no category A drugs. Drugs and some vitamins, including folic acid, vitamin B6, thyroid medicine, are classified category 1A drugs. Then category B, drugs that have been used a lot during pregnancy but do not appear to cause major birth defect or other problems. Category B drugs include some vitamins, acetaminophen, famotidine, prednisolone, insulin, ibuprofen before third trimester. Ibuprofen should not take during last 3 months of the pregnancy. Now category C drugs. These drugs more likely to cause problem for the mother and the fetus. Also includes drugs for which the safety studies has not been finished. Drugs should be given only if the potential benefit justifies the potential risk to the fetus. These kinds of drugs have some many reasons to be more concerned about this drug than the category B drugs. If the pregnant woman will benefit from this category C drug, it is generally used. It includes fluconazole, ciprofloxacin, and also antidepressant drugs. Now category D drugs. These drugs have clear health risks for the fetus, but the benefit from the use in pregnant women may be acceptable despite the risks. D category drugs include alcohol, lithium, phenytoin, chemotherapeutic drugs to treat the cancers. Then category X drugs. These have been shown to cause birth defect and should never be taken during pregnancy. It is contraindicated who are pregnant. The X category drugs should not be used during pregnancy. It includes drugs that are used to treat the skin condition like cystic acne and sedative, that is the thalidomide, etc. Here, a few drugs are listed which are used during pregnancy and are categorized. Analgesics and antipyretics, these are B category or C category. Acetaminophen are B category, and phenacetin B category, aspirin C category, antiemetic B or C category, and doxamine is B category, and magnesium B category. Cyclizine B category, dimenhydrinate B category, antibiotics. Few antibiotics like penicillin, ampicillin, amoxicillin, cloxacillin, ciprofloxacin, erythromycin. These are the B category, but gentamicin is C categories. Amikacin, C or D category, streptomycin D categories, sulfonamide B or D category, tetramycin D category, And antihistamines like albendazole, mebendazole B category, antimalarial drugs are C category, antifungal C category. Tubercular drugs, ethambutol B category, INS C category, pyrazinamide C category. Vitamins are A category, hormones, thyroxine hormone is E category, but estrogen, androgen is X category, and progesterones are D category, and bronchodilators are C category. So it is not a complete list. Patient should advise to check the drug level before taking this drug during pregnancy. Some safety medication to take during pregnancy. In case of allergy, you can use without any thinking Benadryl for cold and flu, acetaminophen. And for constipation, you can use any laxative agents. For skin infection, first aid ointment like bacitracin, neosporin, polysporin, these are safe. And for rash, Benadryl, hydrocortisone ointment also safe. Some women may difficulty in the morning sickness, diarrhea, and constipation. So you should give some suggestion. For constipation, you advise to take fiber-containing diet, fresh fruits and vegetables, and plenty of drinking water. For diarrhea, you advise to take banana, white rice, refined wheat breads, etc. And in case of heartburn, you advise to take small amount of frequent meal and taking cold drinks also. Some medication which are contraindicated, these are the X category drugs. It may causes the various harmful effect to the fetus. Vitamin A, that is the isotretinoin, it causes the birth defect of the fetus. Thalidomide causes the limb defect. Stilbestrone causes the cancer of the vagina and cervix. Warfarin causes the multiple birth defect. And danazole causes the malformation of the sex organ, especially in female fetus. And anti-cholesterol drug is contraindicated because the cholesterol is needed for the fetal growth. Testosterone causes some birth defect. Oral contraceptive and progesterone also causes the birth defect. And methotrexate causes the cleft palate. Aspirins containing salicylic acid should not be recommended during pregnancy, especially last 3 months. Acetylsalicylic acid is a common ingredient for the OTC painkiller. It causes the pregnancy last longer and causes the severe bleeding before and during delivery. Now, NSAID causes the patent ductal arteriosus, that is the failure of closure of the ductus arteriosus, usually present in every fetus before birth. And Ebstein anomalies, lithium causes the Ebstein anomalies. It is a congenital heart defect where the opening of the tricuspid valve is displaced towards the right of the fetus. This is the picture of Ebstein anomalies. Here we are showing this normal heart in the left side, and it is the Ebstein's anomaly in right side, where the opening is displaced to the right side of the heart. Now, thalidomide causes the lymph anomalies. It causes the various abnormalities in the face, limb, ear, nose, vases. This is the picture of thalidomide, that is thalidomide caused by the phocomelia. Folic acid deficiency causes the neural tube defect leading to spinobifida, encephaly, and encephalocele. Valproic acid caused decreased absorption of the folic acid and leading to deficiency of the folic acid may lead to neural tube defect of the fetus. This is the Spina bifida is a developmental congenital disorder caused by the incomplete closing of the embryonic neural tube. Some vertebrae overlying the spinal cord are not fully formed and remain infused or open. This is the picture of the spina bifida. Anencephaly is also neural tube defect that occur when the head end of the neural tube fail to close. It usually occurs 23rd and 26th day of the pregnancy. This is the picture of anencephaly. And encephalocele is also a neural tube defect characterized by the sac-like protrusion covered by a membrane which occur in upper part of the skull and between the forehead and the nose and also back of the skull. This is the picture of the encephalocele. Alcohol-induced fetal alcoholic syndrome. Here, when the pregnant mother consumes alcohol during pregnancy, alcohol crosses the placental barrier and causes the various effect to the fetus. This is the alcoholic phases. This is the alcoholic phases, characteristic phases of the alcoholic syndrome. And valproic acid induced fetal valproic syndrome. Valproic syndrome, it is also contraindicated. It produces the special phases. This is the picture of the alcoholic valproic syndrome. Phenytoin induced fetal hydrantoin syndrome. It is also contraindicated. It produces the hydrantoid syndrome. This is the picture. Busulfan and chlorambucil, these are the chemotherapeutic agent. It produces the drug-induced cleft palate. This is the picture. And opioid analgesics induces the drug withdrawal syndrome. Any analgesis crosses the placental barrier. When after birth of the baby, it produces the withdrawal syndrome. This is the picture on right. The baby produces the withdrawal syndrome. Baby may suffer from withdrawal syndrome. Vitamin A derivatives induced fetal defect may occur. Smoking also contraindicated. It produces the cleft lip, cleft palate, premature rupture, premature birth, low birth weight, and abortions. This is the picture. It produces the cleft lip and cleft palate. So once a pregnant woman knows she is pregnant, stop taking any drugs when already taking and consult physician if you want to continue these same drugs. Unless otherwise it considered as an emergency, do not take any medication. If you want to take and consult physicians. Now, many drugs we are bound to use during pregnancy, like some uterotonic drugs or tocolytic drugs. Uterotonics increases the uterine contraction, like oxytocin, prostaglandin, serotonin, kinin, and catecholamine. And tocolytics are the drugs which decrease the uterine contraction, that is the spasmolytics, beta receptor stimulating medications, and antioxidant drugs. Myometrium has alpha and beta adrenoreceptor. Stimulation of the alpha receptor by catecholamine causes the uterine contraction, and stimulation of the beta receptor by catecholamine, it causes the uterine relaxations. Uterine body contain alpha beta catecholamines receptor. Lower segment contain the choline and serotonin receptor. Cervix contain chemo, baro, and mechanoreceptors. Now, very important drugs is oxytocin. It is a non-peptide. Nonapeptide is synthesized from the supraoptic paraventricular nucleus of the hypothalamus and transmitted to the posterior pituitary, where it is stored and eventually released. Its half-life about 3 to 4 minutes and duration of action about 20 minutes. It rapidly metabolized and degraded by oxygenase. Myometrium oxytocin concentration increases maximum during labor. Oxytocin acts calcium channel to initiate myometrial contraction. It stimulates amniotic and decidual prostaglandin production. Uterine contraction are physiological, that is, it causes the fundal contraction and relaxation of the cervixes. In first trimester, it was almost refractory to oxytocin. In second trimester, relative refractoriness persists as oxytocin can only supplement other abortifacient in induction of the abortion. So you are not using for induction of abortion. In case of induction of abortion and later month of the pregnancy and during labor, it is highly sensitive to oxytocin with very small doses. It is indicated therapeutically or diagnostic. Therapeutically during pregnancy, labor, or puerperium. During early pregnancy, it accelerates the abortion, that is in case of inevitable or missed abortion, or also to expulsion of the hydatidiform mole, and to stop bleeding following evacuation of the uterus. It is also used in conjunction to induction of the abortion along with the other abortifacient like prostaglandin E1 and prostaglandin E2. And late in pregnancy to induce abortion and to facilitate cervical ripening for effective induction. And during labor, for augmentation of the labor, in case of uterine inertia, and also active management of the third stage of labor or following expulsion of the placenta. And during puerperium, to minimize the blood loss to control the PPS. For diagnostic purpose, contraction stress test and also for oxytocin sensitivity test. But it has some danger when administered in late in pregnancy or during labor. It may cause uterine hyperstimulation, uterine rupture, water intoxication, hypotension, and antidiuretics. And for fetus, it causes the fetal distress, fetal hypoxia, fetal death, and neonatal jaundice. Route of administration and IV, IM, buccal, or nasal spray. Now, ergot derivatives, out of many ergot derivatives, two are used extensively as oxytocins. These are the ergometic and methargine. Ergometic is alkaloid isolate from the ergot. It is a fungus developed commonly in cereal like rice or wheat, etc. Methargine is also semi-synthetic product derived from lysergic acids. It acts directly on myometrium and exerts uterine contraction, which comes so frequently as one after another without increasing intensity, and that pass into a state of spasm without any relaxation in between. So, if aromatine causes the vigorous contraction without any relaxation phase. It should not be used in induction of abortion or labor. It is highly effective in to maintaining the hemostasis to stop bleeding from the uterine sinus either following delivery or abortion. Methadone is slower in producing uterine response in contrast to ergometic when administered intravenously. Ergometic and ethospan can be used parenterally or orally. It produces tetanic uterine contraction. The preparation should not be used either in late second stage of labor. It should be used only either in the late second stage of labor after delivery of the anterior shoulder or following delivery of the baby. It is indicated to stop atonic uterine bleeding following delivery, abortion, or expulsion of the hydatidiform mole. It also used prophylactically in case of extensive hemorrhage following delivery, following the after delivery of the anterior shoulder, or also management of the third stage of the labor. It is contraindicated suspected multiple pregnancy after delivery of the first baby. It also in organic cardiac disease. It may cause sudden squeezing of the blood of the uterine circulation into the general circulation, ultimately causes the overloading of the right heart and precipitate heart. But it is contraindicated in case of suspected multiple pregnancy after the delivery of the first baby. And some organic cardiac disease, it may cause sudden squeezing of the blood of the uterine circulation into the general circulation, causing the overloading of the right heart and precipitate heart failure. And also in case of severe preeclampsia and eclampsia, it may cause a sudden rise of blood pressure. And it is also contraindicated in case of RS negative mother. It may causes the fetal-maternal microcirculation. So you should not give in case of RS negative mother. And also should not give in case of heart disease or severe hypertensive disorders. Some hazards like nausea, vomiting, it precipitate a rise of blood pressure and myocardial infarction, and gangrene of the great toes, and interfere with lactations. Now, another very important drug is prostaglandins. It is a derivatives of prostanoic acid. It have the properties of the acting as a local hormone. It is a 20 carbon carboxylic acid with a cyclopentanic ring, which is from the polyunsaturated fatty acids. Of many varieties, prostaglandin E2 and F2 alpha are exclusively used in clinical purpose. It is synthesized from one of the essential fatty acids, that is the arachidonic acid, which is widely distributed throughout the body. In female, these are identified in menstrual fluid, endometrium, deciduum, and amniotic membrane. Prostaglandins increase biosynthesis of prostaglandins of E and F series on uterus is a prerequisite for the both labor in term and preterm. Prostaglandins are paracrine or autocrine hormone, acts locally at the site of production. Decidua is the main source of prostaglandins. Fetal membrane produces the prostaglandin E2 and myometrium mainly produces the prostaglandin I2. Prostaglandin F2 alpha promote myometrial contraction, and E2 helps in cervical ripening. Prostaglandins promote myometrial contraction irrespective of duration of gestation, while the oxytocin acts on uterus as a term or labor. Term pregnancy or labor. So prostaglandins is effective in first trimester medical termination of the pregnancy, also for induction of the labor at term. But its side effect is less when used in vaginally. Local application of prostaglandin E2 gel is gold standard for cervical ripening. It is used in case of induction of abortion, that is a medical termination of pregnancy, and also missed abortion, and termination of the molar pregnancy, induction of the labor, cervical ripening, acceleration of the labor, management of the atonic PPS, and medical termination of the tubal ectopic pregnancy. It is contraindicated when it is hypersensitivity to the drugs, and also in uterine scar. Prostaglandin E2 and F2 alpha have got oxytocic effect on the pregnant uterus when used in appropriate dose. Mechanism of action is in change in myometrium cell membrane permeability and alternation of the membrane bound calcium. Prostaglandin also sensitizes the myometrium, and prostaglandin E2 acts mainly on the cervix due to collagenolytic effect. It has got the powerful oxytocic effect irrespective of period of pregnancy. But in later months of pregnancy, where the pre-induction score is low, or in case of intrauterine fetal death, it is more effective than the oxytocin. It has no antidiuretic effect, but the oxytocin has the antidiuretic effect and causes the water intoxications. But it is very costly. and sometimes may produce an unpleasant side effect like nausea, vomiting, diarrhea, pyrexia, bronchospasm. But it subsides promptly due to the rapid metabolism of the prostaglandins. When used as an abortifacient, extensive cervical laceration may occur. Hyperstimulation of the uterus may occur during induction. Prostaglandin E2 is widely used because it has less toxic effect and more effective than prostaglandin F2 alpha. But prostaglandin E1, that is the misoprostol, has been used to cervical ripening. Transvaginal misoprostol is used for induction of the labor. To arrest PPS, argometin is the life-saving drugs. In refractory cases of atonic PPS, prostaglandin F2 alpha and prostaglandin E1 is effective choice. Now, antihypertensive drugs when used in severe eclampsia and hypertension. Most important is labetalol, IV labetalol, but it produces some side effect like headache, nausea, vomiting, postural hypertension, and liver damages. It doses about 1 to 200 milligram BD or TDS. It is contraindicated in asthma and marked bradycardia. Then hydralazine, that is the vasodilator. Its side effects: severe headache, nausea, vomiting, dizziness, flushing, tachycardia, palpitation, and severe hypotension. Because of the hypotension, so before using this drug, should preload is needed. It is contraindicated in SLE, severe tachycardia, and MI. Now, nifedipine, it is a calcium channel blocker. In mild to moderate hypertension, we can use 5 to 20 milligram TDS perorally, but in severe hypertension, we can use Zeta tablet 10 milligram perorally. And in case of tocolytic, acetocolysis, increment the doses every 20 minutes until contraction stops. Then it should continue its drug at 20 milligram TDS. Its side effect is headache, dizziness, palpitation, tachycardia, hypertension, sweating, and syncopal attack. Now, very important drugs is magnesium sulphate. We are using it for the prevention and treatment of the seizure in case of preeclampsia, severe preeclampsia, and eclampsia. Those are already mentioned in your respective topics. It produces the some side effect like nausea, vomiting, flushing, drowsiness, confusion, loss of tendon reflex, hypotension, decrease urinary output, respiratory depression, arrhythmia, cardiac arrest. So, because of the toxicity, magnesium level should be monitored. And some obstetric emergency means the occurrence of serious and dangerous nature developing suddenly and unexpectedly, demanding immediate attention. It includes preeclampsia, eclampsia, antepartum hemorrhage, postpartum hemorrhage, amniotic fluid embolism, congenital heart disease, and eclampsia. Dear students, this is all of my today's classes. Hope you are safe at home. Thank you.